Michelle Dellene, your Facebook president, and I'm also the CEO of Michelle Dellene LLC. I own a coaching business, and I'm on a mission to heal the healers by bridging the gap between Eastern and Western medicine. That's why I'm up early teaching yoga and here teaching you about meditation. Meditation has transformed my life. You can imagine 5 years ago, I was diagnosed with MS. I lost control over my legs. My primary care doc even told me to quit my career as a PA. And I was like, do you know who I am? No. It wasn't that easy, actually. Many months of tears and struggling to figure out like how I was going to get better. Because in the world of allopathic medicine, the treatment for MS isn't really that great. So I dove down the rabbit hole, and here we are. Learned how to meditate, learned how to apply the philosophy of yoga, a lot more than the posture, but the practice of compassion, speaking your truth, brahmacharya, practicing in moderation, like eating and indulging in all of the worldly things. And I came out the other side, not only put my MS into remission, all the lesions that once were all over my brain are gone, but I came out a different person, a person with purpose, really with this newfound passion to be the best that I can be in every single area of my life. And that's when I found ASPA. How cool, right? So I'm really excited to share with you this powerful prescription of meditation. It's so simple, but it really comes down to this decision you make every day when you wake up. It's like, hey, what's my intention here? How am I going to walk into this day with power and purpose? How am I going to show up as the best PA that I can be? How can I really offer something to my patients that can change their life, that can heal them? I'll teach you. So let's begin. Meditation as medicine, a prescription for healing. I mean, we've all heard about this, right? And they're like, yeah, I meditate. And there are so many different ways to quote unquote meditate, which means to become familiar with. Well, to become familiar with what, Michelle? Does anyone have any idea? Raise your hand. No idea? Yeah?
Like become familiar with yourself, like feeling at peace.
Peace. Become familiar with yourself. Yeah. What else? Well, wherever you're putting your attention is where energy flows. So you're becoming familiar with it. So in meditation, you have this option to become familiar with what's known as this unconscious space, the space where everything all at once and nothing at all resides. It's quite interesting and esoteric. I'll narrow it down, make it easy for you, but it can really balance your central nervous system. It can really allow you to focus on what is important in your life, and it can allow you to stay grounded amidst the chaos of being a surgery PA, especially when stuff goes down in the OR, on the floor, your patient starts to crash. I noticed just the other day, which is really interesting, I was at the bedside as the patient was really going through it. She was screaming. She's like, I'm so afraid. I'm going to be paralyzed. I can't move my legs right now. Am I going to be like this forever? You know, and she was allowing the moment to really get to her. And her husband was there too, just screaming at like all the nurses and doctors and providers coming in. And I took her hand and I coached her through a breath practice, and I told the nurse to get some Ativan. And yeah, it's in that moment of being really grounded where like it didn't seem like chaos, because stress, in fact, is not what's happening out there. It's your reaction to what's happening. And if we can choose to respond in this very grounded nature, we have the opportunity to not even experience stress, which is kind of cool. Now I'm human, I experience stress on a daily basis, but there are those moments where you do feel really grounded. And what surprised me in that situation is I looked behind me and there was about 6 providers and 2 nurses. And they were all looking at me like, Michelle, what do we do next? I'm like, whoa, how did I get here? Like, I used to be the one learning from everyone. And it's kind of cool just to see how your life evolves, you know, when you really choose to take good care of yourself. So this is my prescription for meditation. Perfect. Let's begin. I'm going to teach you a little bit of neuroscience. You know, I'm a neurosurgery PA, and the neuroanatomy and the physiology of understanding the neuroanatomy and also understanding how meditation influences our neurophysiology not only is cool to learn, but it helps us understand why meditation is so powerful. So let's get into it. The first thing that happens when we meditate on a consistent basis is we develop increased cortical density. What does that mean? Anyone have any idea? Increased cortical density. You think about a neuron, right? Yeah, you know what that is? Yeah, I'm in a room full of smart people. Shout it out. What's a neuron? Nobody knows? A nerve cell. Yeah. We have them in our brain, throughout our body. This is, you know, how that electrical impulse is generated. It propagates down through the axon, out through the axon terminals, and releases neurotransmitters, and then works as this cascade effect going from one neuron to the next. Incredibly fast. And this is how we think and move our leg. This is how we can choose to consciously breathe. This is how we can choose what words to speak. All of it, right? And so what meditation does is actually increase the cortical density, meaning the maturation specifically of the insular lobe, which is just deep to the temporal lobe. This increases the amount of cell bodies within that brain tissue through the development of neurogenesis. So these nerve cells are actually creating more of themselves. Have you ever heard when you think something, you can create neuroplasticity, and what fires together wires together, and you create this network that in the beginning, it feels so odd. It's like brushing your teeth with the left hand. You're like, oh my God, this is weird, right? Well, you're creating new neurons inside of the right hemisphere. And if you're not used to that, it feels awkward and choppy, just like the first time you suture or do vein harvesting or what have you. But after you've been doing it, Phil will tell you 35 years, it's easy. Feels like butter, it's smooth, right? And it's because that neuroplasticity creates this really solid, dense foundation of neurons, and that's cortical density. That's what we can appreciate under the microscope. So we not only see that in the insular lobe, which is a part of the brain that's responsible for self-awareness, for emotional regulation, for connection to each other, and that feeling when perhaps you're in the OR and everything is flowing and just going so well. It feels like, ooh, it feels good, like you're in it, you know? People say that's flow state. Or perhaps you're in the forest and you're looking at the trees and the sun and you just feel this overwhelming sense of peace. That's the connection to the insula. You can actually decrease your heart rate. You can decrease diaphoresis, sweating. You can regulate your nervous system through the development of cortical density increase within the insular lobe. So meditation not only affects the insula, but also our hippocampus. It looks kind of like a seahorse up here. You see this guy? What does the hippocampus do? Do you guys remember all the way back from school? Anybody?
Emotions?
Emotions? Yes, emotional regulation. What else? Can you remember? Yeah, your memory. And you see patients with memory deficits with Alzheimer's disease, the hippocampus is affected. And so meditation can be really powerful at restoring memory. For my ladies who are moms, it can help with the mom brain. Yes, we have a solution, and it's free. Coughing for confirmation, thank you. And it also decreases the size of the amygdala. The amygdala is this almond-shaped structure, and it's just anterior to the hippocampus. This is the part of the brain that makes us feel afraid. It's the part of the brain that stimulates that stress response, the flight or fight response. Maybe you're in the OR and you're like, oh my God, I don't know what instrument he needs. And you start sweating and he's looking at you and you're like, I don't know. Right? If we can choose to be present, to breathe, to reconnect to the insular lobe and kind of shift our attention away from feeding that stress response through activating the amygdala, well, that power can come through the repetition of meditation. And it directly influences the structure of our neuroanatomy, which is kind of cool. It also allows our brain to communicate within itself in a way that is much more efficient. So whenever we experience anything, it's not necessarily, oh, I'm planning, my frontal lobe is activated. It's actually many different parts of our brain. And so when we meditate, we're able to connect the dots, so to speak, in a way where things just kind of make sense quicker because of that time spent integrating our central nervous system. It also allows us to control our emotions in a way. You think of this kind of like a surfer. If the ocean is this wave of emotions, a lot of energy, emotion is energy in motion, right? Especially if some of our patients get really like in it. Face is red, they're sweating, the level of their speech goes up. You know, if you're sensitive like me, you can feel it. Perhaps instead of feeding that emotion and really like acting through it, you can rise above it. Think of a surfer riding the wave. You can still experience the emotion, but you can choose to speak in a way that is softer, that is slower. You can actually change your heart rate so it's not so fast into a bit more slow pace. You can avoid flushing because instead of feeding the emotion with the body and your attention, you get to choose to show up differently. So it's quite interesting, how much power meditation can provide you. We talked about this already, the reduced amygdala activity. So let's dive into the initial practice. In the beginning, I love teaching meditation, and I always hear the same things over and over. And this is what I hear in the beginning. People are like, oh, Michelle, I can't meditate. I sat down for 1 minute. I can't meditate. My thoughts are going so fast. I want to check my phone, I want to check my Instagram, I want to check my la 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 la. Oh, yes. So our brains are so good at operating at the beta brainwave activity level, right? So we're PAs, we are thinking about our patient on the floor. We're thinking about our cases in the OR. We're thinking about the prescriptions that we need to write, and perhaps even like the patient that's coming into the clinic later after the case finishes. We're really good at multitasking. And so we've trained our brain to operate in this way, to operate at this high beta brainwave level, which is quite fast. But every time we meditate, we can bring it down, maybe into a bit of alpha brainwave activity, which is more focused, and then maybe even deeper with meditation. It doesn't happen in 1 minute. In fact, it takes about 16 minutes to even get there. And in the beginning, you're only there for a couple seconds. So when someone says, Michelle, I can't meditate, and they sit down and their thoughts race, that's part of it. Yeah, you're actually doing it perfectly. So release any of those thoughts and just try. It's like anything, you just have to sit and practice. And what you'll notice is, wow, after about 20 minutes, I do feel a lot more relaxed. I do feel really focused. So what happens if you keep doing it? 3 to 6 weeks, this regular meditation. I recommend every day, twice a day. like I mentioned at the beginning, right before lunch is best, so your body isn't distracted by digesting your food. And then in the morning, so right after you wake up, usually I brush my teeth, I'll sit down, and I'll meditate. That is the way that I prescribed it in the beginning. Usually teach beginners or patients to do it that way. As I've advanced my practice, I found that doing a crazy hot power yoga class, doing a little kundalini, some breath work, on those days where I get to just devote the whole day to healing and my spiritual evolution, I'll do fasting, ice baths, cacao ceremonies, and then your meditation gets like really deep. So there's a lot of things you can do to prepare the body to sit still in meditation. And in fact, physical activity like the postures of yoga are actually created for that. How interesting. And so when you develop this consistent practice and every day you're showing up, after you wake up, you brush your teeth, you sit down, maybe light a candle, meditate 20 minutes, you'll notice that the gray matter density within the hippocampus increases. And what does that do? You remember? Memory. Rod was paying attention. I love it. And what else? You said it before. Emotional regulation. In just 3 to 6 weeks. How fascinating. It's kind of like neurosurgery without the knife. You get to do it with meditation. But what happens if you keep doing it? 3 to 6 months in, you really develop this self-awareness. You notice, oh, wow. This one thing that I keep doing that leads to this outcome, ooh, that's not exactly like in alignment with what I'm intending to do. Yeah, I noticed for me, and I'm gonna be vulnerable here, so get ready. I used to take things personally. Like someone's having a bad day and they were, rough and kind of aggressive, not even assertive, aggressive, or what have you. There's a lot of trauma that can go all around in medicine, especially like in the OR. I take it to heart. And sometimes I go to the bathroom and I cry. And I've noticed through this practice of meditation, not only do I feel less affected by other people's actions and behaviors, I feel really grounded in me. And I can see with new eyes, that they're really hurting. And now, in fact, I'm able to ask them, like, hey, what's going on today? Is there anything I can do to, allow this to be smoother for you? And that changed everything. Changed from going from a victim to a victor, psychologically. And because of that, patients get better care and we get to be better PAs. So what happens if you keep doing it? Yeah, after a year, 2 years, 5 years, a decade. Well, long-term meditation practice solidifies lasting changes in the brain. Think of it like cement. Doing a kyphoplasty, in the beginning, that cement's malleable, it's warm. You can kind of shape it and direct it in a way that you want it, yeah? But then after 8, 9 minutes or so, it's rock solid. This is that time frame for meditation. In about a year, you've really cemented that neuroplasticity that you've created, and it feels smooth. Like Phil, he's teaching our endoscopic vein harvesting workshop. Later, raise your hand, Phil. Oh, we're so happy to have you here. He's gonna move smooth like butter because he's been putting in the reps, yeah? And it takes about 10,000 hours in order to become a master at anything, yeah? So be patient with yourself. Keep putting in those 20 minutes every time and know at about a year, you're starting to concrete that first layer. And every year you accumulate after that, it just gets smoother and smoother. And this allows you not only to regulate your emotions in a way that is incredibly empowering, but it opens up this door. And I'll keep this short, but there's so much to talk about, like anticipating your surgeon's next move. perhaps he always reaches for a 3 kerosene, or, he wants like a 2O nylon for whatever reason. And all of a sudden you get this feeling, you're like, I think he wants a 2. I'm gonna reach for a 2. It's like, I'll have a 2 kerosene. I'm like, I knew it. It's like that magical intuitive ability that can kind of arise after putting in the reps of meditation over and over. I've had a surgeon ask me, they're like, hey, can you read my mind? Like, oh yeah. Like our thoughts is just kind of like a radio frequency, and we can tune into it or tune out of it, just like based on our intention and our awareness. So we're a lot more intelligent, a lot more powerful than I think most of us give ourselves credit for. So might as well explore it, right? All right, so enough about us. What about our patients? How can we really prescribe meditation in a way that's simple to understand and in a way that can change their lives, that can expedite their healing? I'll teach you shortly how to prescribe meditation in just 1 minute. But let's talk about exactly what this does for them. First thing is it reduces anxiety and stress, especially for chronic pain patients, the ones that perhaps have a spinal cord stimulator or have had multiple spinal surgeries and just, they're not better. They're so anxious all the time. They come with a long list of questions, and perhaps it's more in their head than in their body. I teach them meditation in order to really alleviate that anxiety. And if they do practice it routinely, it makes an incredible difference. Their pain levels drop. Sometimes they get their spinal cord stimulators removed. They get off opioid pain medications, and overall they're living a better quality of life. So this is powerful. That kind of covers that improved pain management, but it also reduces their blood pressure. If you go to tm.org, which is Transcendental Meditation, the type of meditation I'll teach you today, they have a whole page full of literature that has been accumulated since the 60s when Maharishi Mahesh Yogi brought TM over to the United States. And you can look through those. But one thing I see over and over again when it comes to the cardiovascular benefits of transcendental meditation is reducing hypertension. And I think about that. Someone could prevent a stroke, change the whole trajectory of their life, get off these medications. Maybe if they're not on these hypotensives, they wouldn't have fallen and come into your clinic with a compression fracture, right? There's such an influential potential with a very simple prescription of meditation. And better coping skills. Yeah, have you ever noticed that there's generally 2 populations of patients? There's one that, oh, wow, they take full responsibility. They're interested in what they can do to get better. And then there's perhaps another population where, I won't even say it, but you know it. Everything goes wrong because, they don't take full responsibility. And so teaching them meditation very simply can allow them to develop this awareness. Sometimes they don't even understand, what is going on when it comes to this propagation of one health issue after the next. And you can tell them, hey, it's really good for you to stop smoking. But because they're so stressed and they're in this situation at home, they can't quite figure out how to stop. The meditation can provide them with that insight of, oh, maybe I have to have that difficult conversation with my roommate or spouse, and perhaps that can change the whole dynamic here. I'll feel less stressed and maybe even have the strength to stop smoking. Benefits of meditations for providers. Okay, we all know over the last 5 years that the healthcare system has really been taxed. With COVID, with all the shortages, perhaps some of you are brand new and this is all you know. Well, thank you for being here. when I started, how old am I? Oh my God. Someone's like, how old are you? And I'm like, I'm 72. It's just all the meditation. I look so young. When I started, it was very different. There was a lot more people. The team was much more cohesive. It's really interesting to watch how medicine has changed, at least in my perspective of practicing as a neurosurgery PA. And I've watched a lot of people get burnt out and never come back, or perhaps, suffer the consequences, even commit suicide. And it's so sad, but it's true. And this is a really simple prescription that costs nothing, that doesn't have any side effects, that could save someone. Maybe it's for you, maybe it's for a provider that you know. I think we all need to take a deep breath together. You ready? Inhale. And let it go. Just sending all the love and light to all of those providers that are really struggling right now. Ooh, okay, let's get into it. You ready? So this is how you teach meditation in 1 minute. You'll tell your patient to sit upright. Usually they're sitting in a chair, they're in your office. If they're in the hospital and they can't sit upright, that's okay. They can just lay in bed. But as they get better, as they get stronger, encourage them to sit up. And the reason for this is the anatomy, right? You think of your body as like this antenna, and it creates an electromagnetic field. We all know this is true, we can measure it, right? And so your energy and the way that the electromagnetic field is influenced changes upon positioning, changes upon your thought pattern, changes upon what you eat, who you expose yourself to, how well you take care of your body. So when we sit upright, we're actually allowing that spinal column, the cranium to be completely straight, and it can allow for cerebral spinal fluid to flow with the least amount of resistance. It can also teach the body that we're being alert right now as we sit in meditation. It's not time to rest or fall asleep. It's very different than sleeping. In fact, meditation is more restorative than sleep. And in the beginning, when I started practicing this, my daughter was 2, and I was a single mom, and I just bought my first house, and I'd wake up at 4 in.the.morning every day just to get that 20-minute TM in. And sometimes, she would cry, and it was so hard. But I knew that instead of sleeping for an extra 30 minutes, that if I put in the work to meditate, it was going to be better for me in the long run. And it was. So people are surprised sometimes when I tell them that meditation can be more restorative than sleep. Okay, so your patient's sitting upright. If their legs are crossed, tell them to uncross them. You can even take your shoes off, put your feet on the ground, and close your eyes. This is your starting position. Think of your thoughts as waves, yeah? So most of us operate in that beta brainwave, especially when we're multitasking, when we're operating, when we're taking care of our patients, or walking through the halls of the hospital. Right now, you're more relaxed. You're operating in this alpha brainwave state, where some of you are focused, and maybe some of you are dropping a little bit lower into gamma. And meditation brings you into theta. So the deepest, slowest brainwave. And what I encourage you to do is just notice. As you sit there and close your eyes, we'll elect to remain still and quiet for some time. Just notice your thoughts as waves. And so those really choppy ones on the top, those are beta brainwaves. This mantra I teach you called hum sa, think of it as an anchor that pulls your awareness down towards the depths, the stillness, the silence of the bottom of the ocean. And that's you kind of navigating the change of frequency of your brainwave activity. And what happens? You get there, it's quiet, feels so good. You're like, oh, I did it. Ooh, pop right back up, yeah? One of my clients, she's so excited. She's like, Michelle, I was there. But as soon as I got excited, I came right out of it. And they say that, when you desire something and you push it away, you have to kind of surrender and just experience it, which is fascinating. So inevitably, as you rise to the surface and those thoughts come back, just keep reciting Hamsa. Noticing the change in the cadence of your thought pattern, and maybe focus your attention deeply within the center of the body. Some will say that there's this infinite space. It's kind of like you think of outer space, this dark void where nothing, no one exists. And that's a place of pure conscious awareness that we can elect to really integrate, to become familiar with as we practice transcendental meditation. All right, y'all. So you tell your patient these things, they're sitting up, you're teaching them how to actually practice the mantra and what to expect. You're telling them that it's normal to think, and that's okay, that's actually part of it. And then you encourage them, keep reciting your mantra. I offer Hamsa, which a mantra is just a vibration we use as an anchor to change the direction, the focus of our attention. Okay, so let's get past this. Inevitably, when you teach something to somebody, what do? Any ideas? You do it wrong? Well, you can't do meditation wrong, other than not doing it at all. So, yeah. And they're going to tell you all the reasons why they can't. And I tell them, excuses are physical abuses. Yeah? This is ridiculous. Okay, sit down. And people say, oh, I can't meditate. I've done it for 30 seconds and my thoughts are racing. Well, you're actually doing it. That's perfect. Maybe if you sit a little longer, you may experience something different. Some people say, it doesn't work. Well, remember, it takes 10,000 hours to master anything. Did you get your 10,000 hours in yet? And they say, oh, I don't have time for that. What if I told you all we have is time? As we live in this present moment, time is limitless. That's a whole other thing, conversation, that time's an illusion and all of that. Yes, there's 24 hours in the day, but you can prioritize your wellness. You can make time. For me, that meant waking up 30 minutes early and doing it. Don't make excuses, make the time. And I love this one. I can't sit still, because that's me. I love to move and dance and do yoga, and I love to run around the hospital and be in the OR and move at 1,000,000 miles a minute. And I can do that well without burning myself out, I believe, because I do take time to sit in stillness every day. So in the beginning, it was difficult. I felt this. I can't sit still. Dr. Joe Dispenza, anyone know him? Yes, I love him. He says it like this. I saw him live in Switzerland with 8,000 attendees. He goes, stay like a dog. You're sitting there in meditation, you're like, oh, I really want a cup of coffee. Oh, I need to check my email. No, stay. And sometimes I do that. I'm sitting there and I'm noticing, oof, I want to move, I want to get up, I want to answer that email or just text this one person this one more thing. And then I'll say it out loud, stay. And you're training your body to sit still. And with repetition, you do. So, all right, everyone grab your phones, scan this code. This is Insight Timer. This is the app that I use to meditate every single day. And what I love about this is it gives you a quote every time you open it up, which is really inspiring. And it also allows you to track your meditation, all the hours, the reps that you put in. This app too is great for people who suffer from insomnia. There's a lot of free resources like Yoga Nidra can help you fall asleep. So take some time to sign in, and you'll notice this pulls up an invitation to join this group meditation. And together we can all track our meditation here. Anyone have any questions about the app as you're getting signed in? No? What I love about this is it's not an alarm. Like if you say to your phone, I won't say it out loud because it'll trigger everyone's phone right now. Set a timer for 20 minutes. She's like, okay, Michelle, let's go. And then all of a sudden you're deep in meditation and then this terrible alarm comes on. It almost feels like everything you just worked so hard to create dissolves in that moment because you're like shaken to your core by this terrible alarm. Insight Timer offers these very gentle bells that you can choose from to pull you out in a way that's really peaceful. And so it's not reversing everything that you just worked through. I love it. You guys are so engaged. What are you here for? To meditate, to work on your stress levels, your sleep. I can see you all going through the app, picking everything. Perfect. And as you get all settled in, I'll mention that meditation serves as a transformative prescription for both patients and healthcare providers, enhancing emotional well-being and fostering resilience. By integrating meditation into healthcare practices, we can promote holistic health that benefits all of us. You know, not only are patients feel better, not only does our team operate in a way that is more efficient and with less experience of stress, but in a way we're healing like the medical system from the inside out. You know, just think about the power of the butterfly effect. Okay, so let's begin. For 20 minutes, we'll practice together. Do you guys have any questions before we get started? Okay, cool. So we'll close our eyes. Spine is nice and tall. You can take off your shoes, place your feet on the ground. Take about 30 seconds to really get comfortable here. Breathing deeply through the nose and out through the nose. You can rest your palms atop your thighs, or perhaps lift your palms up to receive energy. And when you're ready, you'll start to recite your mantra, Hum Sa, silently, using it as an anchor, pulling your awareness deep within. And shortly, I'll guide you back. Nice and slow, start to bring your awareness back into your body. Keeping your eyes closed, slowly move your hands. Maybe shrug your shoulders. Stretch from side to side. Take a big breath in and let it go. Allow small amounts of light back into the central nervous system by opening and closing the eyes. Taking some time here to ease the state that you've created. That was about 10 minutes. I like to leave some time at the end to check in, to share your experience and answer any questions that you have. How are you guys feeling?
Calm.
Calm. Yeah.
I never stopped thinking.
Never stop? Yeah, that was pretty short. Like I was saying in the beginning, it really does take about 16 minutes or so in the beginning to get a little glimpse of that piece. And when you're searching for it, when you're trying to get it, you push it away. But with repetition, it will come. So just don't give up, okay?
What came to mind was certain things that are different than this. For instance, when I get out of work, I go to the gym and I work out, and that's my way to clear my head.
Yeah.
But is it a false sense of clearing your head because you're not focusing things down, you're just readjusting. And I actually find I solve a lot of problems when I'm working out because my brain clears from all the other junk,
Yeah.
and I'm thinking about solving a problem.
You're certainly clearing your mind to
So-
work out.
That's different kind of thing because you're
That's
completely
called
opposite of this, is that.
focused attention, focused awareness attention. So with the kind of meditation we just did, it's known as automatic self-transcendence, where you allow your attention to integrate with pure conscious awareness, which is nothing on the outside. It's just everything on the inside. But the meditation that you talk about when you work out, that creates this clarity, the sense of lightness in the mind, and you solve a lot of problems. That's called focused attention meditation. So out of the four main types, that is a type, but this is just different.
Have you heard a lot about the smartwatch functions that sense your energy level? I mean, I had upgraded my smartwatch, and this one has all kinds of features where it supposedly measures your energy level, and it also has little breathing exercises on it if it senses your energy levels not right. Have you heard of these kind of things?
I no longer wear a smartwatch. When I did 5 years ago or so, I do remember setting a reminder to take a breath, but perhaps the technology has evolved into what you're describing. I'm unfamiliar, but I'd love for you to teach me.
Yeah, this one does EKGs, it does,
That's so cool.
it's weird. But you don't know how, I mean, you're thinking, how can a watch sense these things? I don't know.
We're in this time too where technology is just advancing at an exponential rate. It's kind of cool to be a part of it, so I don't doubt it. Thanks for sharing, Phil. How are you guys feeling? Good. Anyone have a cool, like, mystical experience, out of body, feel kind of like sparkly? Any lightness or, yeah? What had you feel?
For a moment, I was on a beach.
You're on a beach? Take me with you guys. Let's just go. It's like an hour away. We'll take my car. Nobody will know. Okay, tell me more.
So I was just walking on a beach with a partly cloudy sky and nobody around, seeing the waves, and because the beach is my happy place. So
Oh my God, I love that. Now, was this a memory or did it seem different?
it didn't seem like a memory
That's cool.
because there was nothing, like no buildings or nothing on the beach, and I never go to beaches that don't have something.
Oh, wow. I love that. And then, do you notice, did it change the way you physically felt?
It's very calm.
Very calm. Mm-hmm. That's great. Thank you for sharing. Yes, Gretchen.
For the longest time, yoga or meditation was really hard because I was like, you just stop thinking. Like, how do you do that? So I was like, okay, maybe black and white, right? Like, draw like an image in your head and it's just black and white. And that didn't work for very long because you just keep thinking. But something like the beach reminded me that when I intentionally meditate, I'll think about like a happy place. And I just created this like pond with greenery around it and a bench on the bridge over the pond.
Mm-hmm.
And that was a good way to just like focus on something happy, and then it makes you happy as well, right?
Yes.
And you can keep thinking. You're still thinking when you do that, right? But
Yes.
it's more serene.
Yes. Thank you for sharing. So that's actually one of the tools that if you find yourself really struggling to do this kind of meditation, you can practice that focused attention, very similar to what Bill does when he works out mentally, and you can create that peaceful focus. And as you strengthen your attention, you'll notice that you can direct it in on nothing, nowhere, nobody, no thing, just that peace, that silence, that stillness, that darkness. And then all of a sudden you're like, I'm doing it. Then you come back. Anyone else want to share? Yeah.
Do you have any other tips on bringing yourself to not be thinking about other things? Because I would be okay for a second and then I'm starting to have different thoughts and I just don't know where to bring it back to.
Mhm. Yeah.
All the thoughts.
You can, her question was, how can you stop thinking about other things? Because it inevitably comes back over and over and over. Well, first notice that resistance. Like, I want to stop it. Let it happen. If you find yourself spending more time there and you'd like to experience a bit more stillness and quiet, you can even say your mantra out loud. Hamsa. If you're alone at home, you can say it loud. And it can help snap you out of the thoughts, like back into the body. You can also breathe. So focus on deep, intentional breath. And when you notice you're kind of more calm, then let your breath go. Recite the mantra silently and just let your breathing pattern return. I noticed noise. Yeah, you guys heard that too? And one of my meditation teachers says, use the noise. If it's distracting you, use it to go deep. And on my way over here, I had my car loaded. And I had this huge speaker in the front of my car, and it was setting off the passenger seatbelt alarm. Oh my God, 30 minutes. And I noticed that ding, ding, ding. I was like, ooh, I can feel myself getting flustered here. And then immediately I remembered, oh yeah, use it. So every time it was dinging, I was telling my mom about this earlier. It's like, ding, ding, ding. Today's gonna be a great day. And every time it came on, I was like, today is gonna be a great day. And I noticed my body stopped sweating, stopped getting frustrated, all like crunchy and tight. So like, ooh, I'm just kind of like flowing now. So if you hear something distracting, if a neighbor starts to mow their lawn, as soon as you sit down and meditate, that's an invitation for you to deepen your practice. What I like to do too is like use it, right? Like I like to sit on my porch to meditate, and inevitably the trash guy will come in the garbage truck, and it's so obnoxious. And I'm like, taking out the trash of my subconscious mind. Yeah, take it away, And the first maybe 100 times or 1,000 or 1,000,000 or whatever, it doesn't feel good, but you're teaching yourself how. It's like suturing or training a dog. Like, you don't just do it once or teach someone something once and it sticks. It's repetition that makes it stick. I hope that helps. Any other questions?
I feel like it's also, like what I try to use that time, I give myself permission. Because I am so responsible and I'm such in charge of everything and constantly organizing it in my head to physically organize it, immediate to, subacute, chronic kind of decisions, that when I stop and say, my permission, it's my time to calm and reset, it's almost like, okay, so stop thinking. It's like I have to tell myself first, and then I can go right into it because I've given myself permission, because I'll get to it. I'll get to the thinking in 20 minutes or in 10 minutes.
Yeah.
Now's my time. Let's go there.
Mm.
And so that helped me a lot quickly, to get there quickly when it's
Yeah.
not so easy to.
Thank you for offering that. That's so true. Yeah, when you phrase it that way, to give yourself permission, it feels less like something to do. In fact, you're granting yourself the opportunity. Oh. Well, thank you guys so much for showing up today and for sitting still and meditating. Sometimes that's the hardest thing that we can do as PAs. We're really good at giving all of ourselves and practicing these cool surgical techniques and using our brain to formulate differential diagnosis and treatment plans. But the real challenge is to sit still and be completely in your own presence, yeah? So no matter what, never give up. And I offer this quote by Majaya Sati Bhagavati. She says, quiet the mind and the soul will speak. Thank you for joining today. We have